Dr. Zoe and Ranj are here to take your calls. We're just going to talk about sepsis first, though, and the important symptoms.
Yeah.
So please point those out.
Well, as Melissa said, sepsis is very common, much more common in adults than in children, fortunately, but the downside of that is it's a lot harder to spot in children. And the symptoms in kids, very much so, can be non-specific. So it's the result of any infection, potentially. There are some infections that are much more likely to cause it, like the infections that cause meningitis, or the infection like Group B strep in babies. The things you need to look out for, there is no one sign that is going to point to sepsis. If you've got a child who's got an infection, and as a result of that might have temperature, it could be high or it could be a low temperature, isn't getting better, could have worsening urine output or peeing less and less, isn't feeding very well, maybe vomiting frequently, not keeping anything down, might have a rash, increasingly lethargic or irritable. Those are the kinds of signs that need to alert you. Could this be sepsis? It's still less likely. Yeah. Most infections in children get better and don't cause sepsis. We need to remember that. But have that in the back of your mind. Don't be scared to ask your doctor about it.
How do you get tested?
So you have to take a combination of the signs and symptoms that your child has or an adult might have. And then there are blood tests to look for signs of infection. And we can, when sepsis is progressing, you can see the signs of it in the measurements and readings that you take, in the physiological measurements. But the treatment for sepsis is antibiotics and fluid resuscitation and supporting your body systems. Catching it early is important, but we need to remember it is tricky. So if you're concerned, either you can go to the NHS Choices website or the UK Sepsis Trust website, and they've got loads of information on there. Melissa and I have both been working with the UK Sepsis Trust to get information to parents, to change the policies for professionals and for the NHS. There's a lot of work being done around it. It's been increasingly recognised, and things will change.
Good. I think to add to that as well, as a GP, if you're concerned, and it's very much that trajectory, it's the child is getting worse when they should be getting better. And as a parent, if you're concerned, we would much rather you bring your child to see us. And if you see your GP and you're not happy and you're still concerned, go back and see them again. If it doesn't seem right,
your child better than anyone.
Go and see your GP.
Okay, all right.
Absolutely. Well, hopefully after the terrible story that we heard there, because there were GPs that did let that slip through the net, that they would themselves be a little more aware of what it was that they should be looking for, or because of their work. So,
thank you.